because it really helps us to identify where things have changed just a little bit so that you can get an idea on what you want to do. So Melissa, what was your complaint? You said?
The lines around here and around here. It's getting a little bit more hollow.
Right. And what was your big concern?
The lines here.
But I mean,
my big concern is I said to doctors I want to look natural and just small changes. I still want to look like myself.
Yes, and this is really what I think it's about. You know, for a lot of my patients, I used to hear, oh, well, I don't see a big difference. And that's really what we want, is we don't want people to go, oh, wow, you had something done. And you know, I've had so many things done: facelift, brow lift, nose job, level. I could go on and on and on. So, and what I like is that people usually don't ever say, oh my God, you had a facelift, or oh my God, you had a brow lift. That's what we really want. We just want people to say, oh, you look good, you look fresh, not, oh wow, you had fillers, right? So what we're going to do is we're going to use the Restylane family, and we're going to address these areas that are bothering Melissa. And when we do a consultation, it's really a great time for us to sort of come together on what we think would be the best approach to refreshing your face. Now, we have gloves, please.
Yep.
Now, the fillers are hyaluronic acid fillers. They're naturally occurring in our skin. They're in our skin and joints. And so this product is great, so you don't have to worry about having a reaction to it. And you can really, even if you're a natural person who doesn't like to do any medications or anything, this is a great one because it's really already there in your skin. Now we're going to start by doing the Restylane underneath her eye over here, and because we want to get rid of this little bit of hollowness that she has. It's more prominent on her right than on her left. Are those all lift?
Yes.
Okay, could we get just some regular Restylane? We'll start with the lift then. Now, one of the things that you'll see with Melissa is she's very, very fit. If we could all be so fit, it would be great. But what happens is, because she's so fit, she has a little bit of hollowness in her cheeks, just a tiny little bit. And that comes from being fit and also having a couple birthdays. So one area we want to have is, we like to have, it's really important to keep dents and depressions in your face. Because without it, you look like a ball. So we want to make it look natural, but we want to soften these dents and depressions. So we're going to start back here, because it looks like somebody actually took their finger and left a little indentation here. So we'll just put a little bit here to soften it. Have you done any facial fillers ever, Melissa? No. So Melissa, this is Melissa's first entree into this, which is always great. Can you see now? Okay. And so what we want to do is we want to just soften this up just a little bit. Can I get a 4x4, please? Thank you. Now I tell people the risks are really minimal with this. Because Melissa, because she was nervous about the result, I'm like, Melissa, if you hate it, we can just melt this away and it'll be gone. And fortunately, we almost never do that, but it's something that people who are nervous can realize that this doesn't have to be forever. And you can see that just softens her face a little bit. It doesn't make her look fat or too full, it just softens the sides of the face. Now we're going to do the same thing over here. This side isn't quite as indented, so we're not going to put as much, but we want to just soften this depression right here. And probably the biggest complication that we have, or side effect, is bruising. Because we do quite a few injections, and so it is likely to bruise. So are they getting...
The ones on the left are regular.
Oh, they're regular. Did they take away the lift?
No, we had two.
Oh, two lift. Oh, perfect. Perfect. Okay, so now we're going to build up her cheek just a little bit. And what you can see is, you know, the forward projection of a cheek should be the most full forward projection should be about parallel to the nostril here, and it should be sort of lateral to, or to the side of this white part of her eye, or the iris. So we're going to just plump this out just a tiny little bit.
Which Restylane are you using? This is lift. Restylane.
And we're using lift here. The difference between lift and the regular Restylane is lift is a little bit bigger particle. And the reason we call it lift is because it lifts up a little bit more. The FDA approval for this was actually for cheek enhancement. And I guess it's going like gangbusters for the company because they're selling a lot of lift. And again, we don't want to overwhelm her. We just want to give her just a little bit of fullness here because it's a little bit feminizing and just softens the face just a little bit. Now, Melissa is nervous, like I said, so we don't want to overdo this. In a regular person, I'd probably do at least one per cheek, but because she's cautious, we can always add more. I always tell my patients it's easier to add than subtract if you're super nervous. Okay, great. So we did a little forward projection there. And now we're going to regular Restylane. So we're going to soften this hollowness of the right eye here. Look up at the ceiling for me, please. And underneath the eye, there are lots of blood vessels, so we have to be extra careful that bruising is something that occurs frequently. Okay, now we're going to soften these lines here. I'll put a little bit in what we call the piriform fossa. Okay. How are you doing so far, Melissa? Melissa's doing great, since she's never done this before. To get quite a few syringes without a little break is...
You're so quick.
Okay. And we'll soften these a little bit. We don't want to overdo this because this can look very artificial very easily. And I don't know if you can see these just disappearing right away, but they really do soften immediately. If you have questions, Jason, do you want to raise your hand? Where's Jason? There's Jason right there. He's the rep for this product, and he's always happy to tell you about the product. He was our Santa one year, and he was our original drunk Santa. My daughter was running around chasing him and going, "Where's Santa?" I was like, "Stay away from Santa." I don't think you've had a drink at one of these since then, have you, Santa? Okay. So what we do is we just put a little bit in the chin too to soften that and make it look a little bit smoother. Okay, and then the next one, please. And in between the eyes, the most common way to treat these creases between the eyes is to do Botox. But with Melissa, she's young enough that she barely has any permanent wrinkles here. But Botox stops working once you've made that expression for a long period of time. You actually have to add the fillers in it to make it look softer again. So we're going to just put just a teeny little bit to help. You can't see? Can you see? Okay, so we're just putting a little bit of filler between the brow. And almost everybody loses volume there. Now, one thing that I really like is, as we get older, we lose fat in our face. And one of the places that you really see aging is around the eyes, because you start to see skin on bone. So if you look at young people, they have a nice pillow effect with the fat around the eyes. And so I like to add just a tiny little bit of volume around the eyes to sort of take away the skeletonizing of aging. So we're just putting tiny little drops. I don't like you to use a lot. And now we can just massage this in so it doesn't look like it's there. We'll just smooth that out a little bit. And this actually can give you a little bit of a brow lift as well. Okay, so now the last thing I want to do is I just want to give a little bit of, this is getting a little bit flat along her cheekbone here. So we just want to give it a little bit of pop, not a lot. Wait any more? Wait any more? How are you doing?
I think that makes it even better.
Yes. Pokes are easier than slow pokes.
Okay, and we're just softening the sheets here. Right. Okay, and then we're going to do, because oftentimes as we get older, we get a little dimpling in the chin. And so what we're going to do is we're just going to add a little bit of Dysport here, because to me Dysport and Botox are essentially the same product. And so we do a lot of both in our practice. And so this just stops the dimpling from occurring in the chin and makes it look more youthful and natural. Okay? And that, yeah, we'll stop there. There are more things I could do, but she's such a good sport to do this, I don't want to scare her. So that's it. So let's thank Melissa for doing this. Thank you. And did anybody have any questions? You can see some bumps. These are usually bruises, and they'll go away with icing and pressure. And after this, we like to have people do ice 10 minutes on the hour until they go to sleep, minimize the swelling and bruising. So, you did great. Okay, thanks.